The treatment options for atrial fibrillation are divided into basically two broad categories. We have either medications or we have different ablation strategies, which is a technique by which we can attempt to eliminate the actual cause of atrial fibrillation inside the heart and potentially cure it. Medications suppress the triggering mechanisms for atrial fibrillation and tend to be more of a temporary treatment and don't get at the fundamental underlying problem in the heart that's causing the atrial fibrillation.
There are three classes of drugs that may be prescribed to patients diagnosed with atrial fibrillation. The first is blood thinners. Blood thinners may reduce clotting and the incidence of stroke. When AF escalates, patients may need to take rate control drugs. These drugs attempt to ensure that the ventricles continue to pump blood to the lungs and body, despite the chaotic activity in the atria. Rhythm control drugs attempt to convert patients back to a normal sinus rhythm.
There are a lot of other factors about a particular patient's condition that are important that need to be taken into consideration, such as whether they have high blood pressure, whether they have sleep apnea, whether they have a thyroid condition, a leaky heart valve, whether they've had a heart attack or had prior bypass surgery. All of those are factors that enter into what might be the best approach for a particular individual. We think that a lot of individuals who develop atrial fibrillation do so because of a predisposition that they may be born with. There are a number of other factors that can place individuals at risk, but if we can go inside the heart with a straightforward procedure and get rid of those triggering mechanisms or those clusters of cells that are responsible for causing the atrial fibrillation, that can be a much better long-term strategy.
Catheter ablation is a minimally invasive procedure that can be used when medication fails to control the heart rhythm. The goal of catheter ablation is to prevent unwanted electrical currents from traveling from the pulmonary veins and spreading to the upper chambers of the heart. During the procedure, catheters are used to terminate or ablate these abnormal electrical circuits and stop them from spreading and continuing to cause AF. There are two main techniques used to perform pulmonary vein isolation: radiofrequency RF ablation and cryoablation. One of the main differences between these techniques is the energy source used during the procedure. In RF ablation, heat is applied to the tissue, where in cryoablation, heat is removed from the tissue by introducing cold temperatures. Both types of ablation result in the formation of scar tissue around the pulmonary veins.
I was very excited about a fix rather than a patch because I certainly didn't want to go through the medication the rest of my life, and I knew enough about AFib that even on medication, it only gets worse. And AFib begets AFib, begets AFib, and then eventually it's just a lifelong thing that's incurable. So I was very excited about a possible fix. So I began to look at the different options of the fix, and radiofrequency ablation was the best fix at that time, but there was a new cryoablation, and that was a much safer thing to me. I just intuitively made sense. So when I found out that that was a possibility, then I clearly wanted to pursue that.